I really don't know why somebody would oppose patients being able to choose the doctor, the physical therapist, the facility that they feel the most comfortable in. It will allow the patient to see the doctor that they've always seen or that they want to see, regardless of whether the doctor's in-network or not in-network, as long as the doctor is willing to accept the fee schedule that the insurance company would pay one of their own in-network physicians. So there are no out-of-network fees. There are no increased costs that perhaps that doctor, they're worried that it would charge more money for a particular procedure. No, the doctor is going to do it for the same price that the insurance plan offers their own doctor.
I have a genetic disease called von Hippel-Lindau. I've been dealing with it since age 7, and eventually I had tumors that were close to, they didn't want them to spread throughout the body, so they ended up taking my kidneys about 7 years ago, and I've been on dialysis ever since. I'm really fortunate to have a doctor that's kind of a multi-layered doctor. He knows the ins and outs and what to do, what drugs not to take, what to do, how to respond to whatever I'm doing. He knows my pain levels.
They help me take care of my diabetes. Well, it's a type of disease.
We met Dr. Gupta within 5 minutes of hearing that River had diabetes. He has a very calming, nurturing way with people. Kids love him. We know he knows the full picture of River's disease. He has that 18 months of history with us, and we truly believe that he's as invested in the care of River as we are. It would be devastating to have to start that process over.
We continue to see the same patients for years, maybe for different problems. You've got to be able to know the patient and how they respond to not only maybe the medications that you give, but the advice that you give, so that they know what needs to be done to be able to take care of themselves. So I think it's one of the most important parts of the doctor-patient relationship. It's very important for making the decision is what's best for them when it comes to whatever their medical care might be.
My wife did change jobs, went from one insurance group to another insurance group, and we were told that I would have to change doctors and change the transplant team that I'm on. Another 2 or 3 doctors to deal with, one with my kidneys, or lack of, another transplant team, another doctor, a neurosurgeon. So the frustration just kept building and building and building.
I don't like it if one of my patients is forced to see another doctor, particularly if we're in the middle of treatment.
I would feel sad if I would have to change my doctor. I have to do one of these every 6 and 3 nights.
He knows that Dr. Gupta will not cause any pain to him. He knows what type of questions to ask, but also for me, because he's only 6½, I do all of his caretaking. I have so much trust in Dr. Gupta. To have to switch to another physician would just be a scary thing for me.
On the same vein, I don't want to have to see a patient who was forced away from their regular doctor for the same reasons. And that is that he knows the patient well. He knows the discussions that they had regarding the different treatment options. And he knows what he did to the patient if it happens to be a surgical procedure. I'm trying to play catch up by listening to what the patient had to say, reading through the notes, but I'll never know exactly what happened when they started that type of care.
When I was 7 years old, I lost the sight in my eye, and I've worn a prosthesis for most of my adult life. And the prosthesis are something that you have to have replaced every so often. If I'm seeing the same provider that I've been seeing for 10 years, they know me, I know them. You have confidence in them that they're going to take that into account when they take care of you. And if you have to go to somebody else, what if you forget some of those details?
It can be very difficult for a physician to become familiar with a patient who has multiple other medical conditions, such as diabetes, high blood pressure, heart disease. We develop a plan of care for the patient, and again with me, a lot of times it's with the parents. And when that gets disrupted, sometime in the interval in the course of the treatment, it can be hard to be able to convey both to the patient and maybe even to the physician on the other end, if you even have that opportunity, what you were thinking, what the plan of action is, and that sort of thing. The patient has something that works for them and things that don't work for them, and to try to figure out with the patient what works best can take some time. And so you can't just say a person has problem X and so therefore I'm going to do treatment Y.
River has a good way of hiding it. He's a tough kid, but I know deep down, every time we have to go visit the doctor, there's a little pit in his gut. And if I had to pick him up from school someday and say, I'm sorry, River, we're not going to Dr. Gupta, we're going to Dr. X, that anxiety that a little boy has would be multiplied intensely.
Whether it's medications or treatment programs or therapy, some work and some don't. Some work well in some patients and not in others. And it's important for a doctor to know the patient and the patient to know the doctor so that you can figure out what is the best treatment for that particular patient at that particular time. And if you're forced to see somebody that you just don't have that level of comfort with, it can be really hard to try to get to the core of what needs to be done.
It's such a big part of our life, so his medical care that goes along with it is so, so important. And so I'm calling the doctor's office or his nurse a couple times a month or weekly.
I did not accept their plan. I did not accept their doctors. Now I have to have a separate policy to stay on the transplant list, and I have to pay out of pocket more for drugs and more for that health care.
I contacted my insurance company and asked them if I needed to have any sort of pre-approval to have this done, and they told me I did not. Made an appointment, had the prosthesis made, and then received a letter from my insurance company that it was considered out of network and that none of it was covered. We had counted on the insurance company to pay for it and had budgeted for it, and when they didn't come through, it was very stressful for our family to come up with the means to pay for it.
This bill would help people get the care that they need. I can't believe that an insurance company has the intellect and they don't have MD behind their name, but yet they want to tell you have to do it. The network costs aren't going to go up unless the hospitals or the insurance companies choose to raise them. I think it might be about the dollar and not necessarily about your or my health.
It's already been shown in studies that in states that these types of laws were passed, it didn't raise costs. In fact, it probably decreased costs somewhat.
As a consumer, as a customer, as a patient, we pay a lot of money for it. Why do we pay for insurance if it's not going to help us when we need it?
If you've been following the same patient for a long period of time, when you already have that record of lab tests, of x-rays, and you know already what's going on, so you don't have to repeat those sorts of things, that alone is going to save money for the patients and for the systems.
17 is a common sense deal. I mean, you know your body, you know your doctor, the insurance company doesn't. I've discussed this with my doctors. He agrees with me 110%. All my nurses, my dialysis people, they agree with me 110%. I have yet to talk to a person that disagrees with me at all.
It will allow patients to make decisions about their own care instead of letting a corporation make decisions about their care based on financial reasons.
When there's so little control, the one thing we can count on is the same doctor, the same person on the other end of the phone when we have a question.
This is about other healthcare providers as well, physical therapists. It's about physician assistants. It's about nurse practitioners. It's about where you have your surgery. If you don't feel comfortable with that person or in that facility, the chance of you having a good result is less.
I do dialysis 5-6 days a week, and I'm busting my butt trying to stay healthy. My grandson, he's a handful, but he loves doing what Grandpa does. No matter what I do, he's with me. I want to live a long, happy life. I got a lot of things to do yet, a lot of places to see. I just want to live.